we had a audit team of 4 auditors that would have a target goal of 5% of our charts. And so they would spend most of their time reviewing through the charts. Serving 13 counties, you're trying to divvy up time between each of those counties. So you're cycling through only a few clinicians every quarter, right? So those were some real challenges, because one of the things that you run into is feedback loop. If you're cycling through clinicians only once a quarter, you're not really turning around and giving them feedback in a timely manner. It was a pretty lengthy process, especially when you're thinking about only doing, 5% of your charts. And let's face it, unstructured data are really hard to read through. The EHR doesn't always make it easy either. So, and you have to really bring in a lot of the context, right? So it really did not allow us to focus on the high risk charts. So clinicians wouldn't get feedback till we cycled around and came around and talked to them 6 months after they actually wrote the note, which was, not very useful. And then, you end up with data silos. You end up in situations where there's data collected by the audit team, but compliance is not fully aware of it because there's lack of visibility, right? And then CQI doesn't really get into much later. And then the biggest challenge we had was, as we're growing, now we're at 2,400 employees, scalability was a problem. It's okay when you're smaller, you could pull this off. But as you grow, you need processes in place that are more automated, right? So those were some of the challenges we were facing.